love me some Erin. I am so happy that the content that I've created helps you. That's always my goal. I was a prior investigator for a board of nursing, as Erin knows. I've been a legal nurse. I've spent my master's degree creating a tool that could be used by anyone, the scheduler to a nurse, to say, should this be a patient, and it's 8 questions that should be sedated by an RN, or should they be screened for anesthesia? As a procedural sedation nurse, conscious sedation, there are rules and regulations under every state, as well as a policy within your organization, but patients are sicker and sicker. And so I was seeing an interventional radiology and endoscopy before. I don't see it as much now because they do use anesthesia way more in endo than they used to. If you go to a surgery center, oftentimes you're going to see a lot of nurse sedate. Hospitals, a lot of times, have gotten away from RN sedation in endoscopy suites. But it still happens every single day. And I just feel like that gets kind of tricky and puts patients and the nurse in a bad situation. Procedural sedation is no joke. If you're a nurse, and just because you're an ICU nurse does not mean that you're a procedural sedation nurse. No. I know this as a nurse. Again, working on my master's degree around procedural sedation. I was a prior investigator for a board of nursing. I grew up in the ICU. I've worked in the ER. I've worked in pre-op where we do some sedation as well for a block. But I have seen ICU nurses have this unfortunate illusion that they are procedural sedation nurses, and they're not, because a patient with a secure airway, an ET tube, is a gift. A patient without an airway is risky. And now you're in a procedural area. They're, again, sicker and sicker. Interventional radiology is the reason why that I created this tool. They use RN sedation a lot in that area, and those are sick, sick, sick patients. So you are welcome, my friend. I am so glad that the content that I'm creating is helping. If you have any questions, concerns, comments, anyone can book time with me. I have a charting course. I have tips, resources on my website. Don't hesitate to get those. And thank you for commenting. Love you, Erin.